Hi, welcome to the BlueWing Show, where we're going to talk about relief, support, care and family for our participants. It is our mission to show you there is help and support and people that care about the individuals.
My name is Del. I am the CEO and co-founder of Cardinal Care Support Services. We are a registered provider based in South East Queensland, but we do cover areas like Gold Coast, Logan, Ipswich, Toowoomba, Brisbane North and South at the moment. We are mostly known for our specialty in mental health. However, we do provide other services within the industry, within the NDIS. Currently, we do have services around accommodation and tenancy, that's sales, STA, ILO, and we do have participants who are, who are with psychosocial disabilities, which we support in those houses. So we do have availability in Ipswich, Collingwood area. We also have in Bouville. We do have a house in Toowoomba South. We also have a sale house in Logan. We are currently working on the sale house in Forest Lake, where we're planning to use it for STA and sale, depending on how it goes. Our participants are, a variety of participants, including those with medical, conditions and those with comorbidities, mental health and medical conditions. And so at the moment, we mostly have a lot of participants with mental health. And that's because of my background. I am a authorized mental health practitioner and a social worker as well. I was with Queensland Health for quite a while, working with the acute care team mental health. I met a lot of participants who would come in to see me in ED and wouldn't know what's going on. And unfortunately, their support system and their support staff wouldn't be able to tell you what's actually happening for them or why, what led to their hospital presentation. So I noticed it happened a lot of times and in different locations, because I worked in Mount Isa, in Kent, in Toowoomba, and the story was the same. So I thought something is not going right. And obviously, these psychosocial disability participants are not getting the quality support that they need. They are not getting the right support. And this is because they are being supported by people who unfortunately don't have the skill set to manage their presentations, their behaviors, and also doesn't know anything about their diagnosis. I don't have any personal experience with regards to mental health, but the thing is, anybody can become a mental health patient anytime. So I think everyone is at risk of, having an episode. So it is important to help people that are in that need, so that they can be, valuable, active members of our communities. I had a webinar the other day where I had to put some time in evaluating some data, and I found out that 40% of providers who are supporting psychosocial disability participants does not know anything about mental health. So that's scary. So that shows you, why you have, placement breakdowns and, participants bouncing from one provider to another because they are not being supported well. I think it's about, putting the right people putting the right providers in the right place, making sure that your support workers, if you're into psychosocial disability, your support workers has to be, skilled in mental health. They don't have to have a degree in mental health, but they need to know, the things that might come up if they are supporting someone with mental health crisis or disability. We do hire people with experience in mental health industry and area, but if they don't have those experiences, we do train them. So we have ongoing training for my support workers to make sure that I'm able to transfer the knowledge I have to them so that they'll be able to support people. Because at the end of the day, I can't support everyone. But if I am able to pass this knowledge to other people, other support workers, then they will be able to support a whole number of people. And that's why I've been, engaging in educational activities like writing articles on mental health and how to bridge the gap, and as well as speaking on events about mental health. Obviously, I'm very passionate about it. That's why I do it. Yeah. Well, I would say that we are now known for being specialists in mental health support in the community.
Yep.
And this is just within the short time that we've been running. So that's a good thing. And we do get referrals for people from support coordinators and individuals or stakeholders who have seen what we are doing in the industry and who have been able to identify with us and see how the quality of support that we provide and how passionate we are actually about what we are doing. We still do, we still provide services to other forms of other participants. We also have all the allied health services. We do have provide OT, speech pathology, speech therapy, and social work. We do assessments as well. Most people don't know that functional capacity assessment can actually be done by social workers, especially if it has to do with mental health. So it's not really solely an OT thing. A mental health practitioner will be able to bring in more light to the day-to-day needs of someone with a psychosocial disability. Yes. So we do that. And in what else do we do? We do community access, capacity building. We do have registration for support coordination, but we've decided that's not what we are going to venture into at the moment. So just to make sure that we concentrate on what we are doing and do it well. We don't want distractions. We have a team of nurses, mental health nurses, social workers, mental health clinician in one of my houses. We also have experienced support workers and the administrative team, yeah. So we do collaborate with a lot of other services that help with getting people signed up for NDIS. But one thing we also do is if we see that someone really needs help, because we are in this industry for the right reason, if we see that someone really needs help and can't afford all these assessments because they are expensive, so sometimes we do help them with assessment free of charge. If you have a medical condition, and wouldn't you go to a specialist? So that's exactly how it is. In mental health, we are specialists in mental health. So what I tell people is it is better for you to go to where they know how to support you than just to try every other options.